Well, Amy, I haven't seen you for over a year after our treatment back in 2009 for you. It's so good to see you again.
It's good to see you too. Thank you so much.
I first met Amy when she came to our emergency room. So it was in the middle of the night. I went in and looked at her right leg. Her right leg was very swollen, had been swollen over the past day or so. And we recognized that it could have been a very life-threatening infection. Necrotizing fasciitis is what we call it. It just means a really bad infection that gets into the tissue. So she had a total of 4 visits to the operating room, yeah. and then you I think moved out of the ICU after what, about a week or something?
Yeah, it was about a week.
It
wasn't very long.
And so then she was on the regular floor and getting antsy to get home because, you know, the kids that she's got to take care of and all the things that she has to do.
Life doesn't stop.
With her life and so on.
I just remember how motivated she was to wanting to get back to doing everything she wanted to do. Just getting back to normal life. Who cares about this infection? I know it's serious, but I want to be running. I want to be active with her kids and just doing what she wants to do.
I didn't know what to expect. I was nervous. To me, it was just another doctor name. I didn't know. You know, I just knew I needed help. And then it was really nice that after, actually I met you consciously. And
after you woke up.
After I woke up and I actually met you, how kind you were, how approachable you were with any questions, any concerns that I had. You know, it wasn't just you come into my room and go over what 5-minute questions you had, progress check, and you're out. You took the time with me and spoke, you know, about anything and everything at that moment, and you were there. For me, it was very rewarding, not just being a patient, because I became your family. You know, to me, you know, you always go into a hospital and you wonder what kind of bedside manner that you're going to get, if any. You know, you're lucky. But each and every person made me feel like I belonged. You know, mentally, it's challenging trying to stay on the up and up. And at the moments when you need it most, you'd come in and say something encouraging, you know, not because that's what you had to do. It's because who you are. It's because you're genuine in who you are, and you're doing the right thing that you're meant to do in life. And it's a perfect fit with OSU and the team.
And I think that's really the concept that we have here at OSU.
I just sincerely want to thank you, because you opened my eyes through something traumatic. You opened my eyes to something wonderful. I got a second chance at doing life a different way, more quality. You know, it's not the quantity of time, it's the quality of time that you spend in life. And I knew after you took care of me, I had a responsibility, you know, to do things different, to live life a little bit fuller, that every day means a little bit more now. And that's because of you. And I'm very proud to have you guys. I'm very proud to have you as my surgeon and to have OSU, and it's meant the world to me that you gave me a second chance. So thank you very much.
Very, very welcome. Thank you for that. It was wonderful.